I just think that, having years of prohibition and lining up political sides against, issues that really ought to be dealt with scientifically and medically is just wrong. I think that, that politicians should leave decisions about drugs and pharmaceuticals to the scientific community and to physicians to decide what is appropriate for their patients.
Well, I think it's a shame at this time that we still have a problem with old-time concepts concerning marijuana when it can be used for medicinal purposes. We're not talking about legalizing it for recreational use. We're talking about helping patients who are suffering from their illnesses to reduce their pain. I don't see why the government needs to be concerned about this kind of use, and I think it's pretty sad that people in need of this kind of help can't get it, and I await the day they can.
I always felt that living in New Jersey that we were one of the, the more progressive states, and it's a shame that we weren't more on the early leader list in terms of dealing with this issue. I think that those people who are very afraid of this need only look at those states that have, already passed these measures. The sky hasn't fallen. This is not something that affects huge numbers of our population or has changed the pattern of use or abuse of any drugs in the community. And I think, again, looking at New Jersey as one of the more progressive states, at least that's what I always thought, that we would have been out front in leading the charge in terms of, saying we need science, we need to use the science that we have, we need to make decisions based on science and move the politics out of the arena.
I kind of resent the idea that I had to feel as though I were a criminal by taking a drug that actually helped me get through a very serious time in my life, and had to hide it and not speak of it in a positive way. I don't think that contributed to my health at that time, and so I would hope that in the future people would not have to feel the way I did, that they in fact were breaking a law by using a substance that was only served to be beneficial.
I, through the internet, for years have been researching various illegal drugs. I started my community's Neighborhood Watch program with the New Jersey State Police right before I was diagnosed with multiple sclerosis, and I educated myself. And as my disease progressed and I wanted to learn more about the medications, I came across research and tests and proponents of legalized marijuana. And I thought, I took a different perspective on illegal drugs, where I, through my own personal experiences, realized that legal prescribed medications had harmed me irreversibly. And here's marijuana that's been used for thousands of years. No one's ever died from an overdose of marijuana. Marijuana does not have the side effects that my legal prescribed drugs do, that are really doing me more harm than good. But I cannot use it without risking going to jail, having my husband and my oldest son, who are New Jersey law enforcement officers, losing their job. What's a person to do? But I would be willing to utilize this medication under a doctor's order. I would feel so safe using it. It's from, the Indians for thousands of years. And I would like the opportunity.
And I think just pass some sort of legislation. It's been 20 years since this sort of research has been coming out on the efficacy of medical marijuana. People have been waiting their entire life to use the drug legally. It's time for them to make a decision and pass the law now.
As an American citizen, government is overly intrusive. What I discuss with my physician, it's between me and my physician. That's what the oath is for a physician. It's confidential information. It's really not government problem to step in and say how they're going to dictate my health care.
is not right. It doesn't belong in the political spectrum. It belongs in the scientific and medical community. We should be able to review these things, do the research we need, publish the research that we need, come to conclusions about it, discuss it with our patients, and prescribe it if we think it's appropriate. I would like to see politics out of the formula.
I am not an educated person, but I've researched this a great deal. It's being accepted in Europe and in Canada. A lot of countries have come to realize that it's okay to use medical marijuana for chronic diseases, to alleviate pain, to alleviate the suffering of those that are dying, for the terminally ill. Yes, I look healthy, but I wish someone could walk in my shoes to feel what I go through every day.
I think the critics should undergo the process of chemotherapy treatment and then speak their opinions.